By this time, if you've been watching my videos, you know that I talk about endometriosis a lot. So I'm pretty sure that you've heard of it, but do you know some of the statistics that can go along with endometriosis? If not, I'd love for you to stay, watch my video, and learn a little bit about that. One in 10 women have endometriosis. So I'm pretty sure you have or know 10 women. 1 in 10 of those women have a diagnosis of endometriosis or have endometriosis and don't have that diagnosis yet. That's 200 million women worldwide, 8 to 9 million in the US. The average length to get a diagnosis of endometriosis, which really sucks, is 8 to 12 years. And this is because a lot is not known about the condition. A lot of providers aren't trained to diagnose the condition, and because the way to diagnose the condition is via surgery, and it's invasive. So it takes about 8 to 12 years to get a diagnosis of endometriosis. For women who suffer with endometriosis, the CDC reports that on average, 18 work days per year are missed due to endometriosis flares. That's a lot of missed days of work if you think about it, that aren't planned, but related to illness, related to endometriosis flare-ups. Did you know that endometriosis was the leading cause of gynecological hospitalizations? It's to 105,000 hospitalization days for endometriosis patients. And 70 to $90 billion in healthcare costs. And yet we still get 64 cents per patient diagnosed with endometriosis towards endometriosis research. Beats me. 70% of adolescents who complain of abdominal or pelvic pain or menstrual cramps, 70% of those adolescents are diagnosed with endometriosis down the line. Times.com recognized endometriosis as one of the top 15 misdiagnosed diseases in the world. Riddle me that. Those with endometriosis see an average of 7 different healthcare providers before they are actually given a diagnosis of endometriosis. And before they're even referred to a specialist, they're seeing 7 different providers. Despite medical management, pharmacological intervention, 7 to 10% of those with endometriosis still suffer with pain despite any type of intervention put in place to help them with those flare-ups and with that pain and other symptoms that they may suffer from. With these stunning numbers, I know you're sitting there wondering, like, why the hell isn't this talked about more? That's a question I'd like answered to, and that's why I will continue to talk about it as much as I can to spread the word, to decrease some of these numbers, to decrease the time it takes for a woman to get a diagnosis of endometriosis from 8 to 12 years. That's ridiculous. There needs to be more specialists. There needs to be more awareness. There needs to be more education. And I'll do what I got to do to make sure that's in place. And I hope some of you will help me with that, especially the education piece. I feel like this should be taught in middle schools and even elementary schools and high schools, definitely, because those young girls that start their menstrual cycle and they are noticing that their periods are painful or they're having some, heavier bleeding or what have you, if they know about this, they would know to go to their mom, go to their dad, and then from there go to a healthcare provider to be screened earlier, to be sent to the right providers earlier, to decrease some of these symptoms that they may have down the line, such as infertility. But if there's no education piece put into place, how are they going to know that? That's my biggest thing, education. But until next time, definitely comment, share, like, and I'll see you guys at my next video. Thanks for watching.